Hello, dear doctors. Today we will speak about head and neck anatomy, skull bones anatomy by Dr. Aqeel Islam, which holds a bachelor degree in medicine from University of Baghdad, and currently I'm student of master degree of anatomy and embryology and histology from the same college. I'm studying this topic, this specialty. This is our first lecture on this course. In the beginning, in the introduction, the human skull is a complex structure that serves as a protective encasement for the brain. We all know the most important structure, the most important organ in your body is your brain. You are your brain. Every other every other organ theoretically can be transplanted, but the brain, the brain is you. You are your brain. If you had a brain transplanting surgery, you won't be you anymore. You'll be another person. So the skull bones are one of the fundamental functions of it is the protection of the brain and supports the structures of the face. You know, uh, another important structures are located in your face are they are your eyes located in the orbital cavity or the eye socket and your nasal or your nose in your nasal cavity and your mouth. So all of these structures are located in your face. So the skull bones supports the structures of the face and provides attachment site for muscles involved in chewing. Chewing is one of the important functions that the skull does through your mandible. Your mandible moves up and down to chew the food that you ingest. Um, and of course, your facial expressions and head movement. Next, the skull is composed of 22 bones. The skull bones are fused together at immovable fibrous joints such as the sutures. You know, skull bones are flat bones. Most of them are flat bones. Those flat bones are connected to each other by sutures. Those sutures are immovable, considered as fibrous joints. The type of these joints is are fibrous joints. And the skull has associated bones of associated bones. These associated bones are the auditory ossicles, three auditory ossicles on each side, which are the smallest bones in your body and the first to be embryologically developed. You know, your auditory, your or auditory ossicles, one of the first bones to be developed in your body, and is one of the most, I mean, the smallest bones in your body, located mainly in your middle ear cavity, and your unpaired hyoid bone. The hyoid bone is located in your neck, the hyoid bone. So, some references consider these bones are part of the skull. So, when they speak about the number of the skull bones, they say skull has is composed of 29 bone. I mean, yes, 29 bone because they add those six bones of the auditory ossicles. We know they are paired, three on each side, so six auditory ossicles and one unpaired hyoid bone that make them seven bones. They are added to our 22 bones, so they make 29 bones. Some references consider it. Some references consider it as associated bones. In addition, we have 32 adult teeth. Those teeth are not considered as a single bone or are not considered a bone itself. It is part of the bone or extension of the bone. They are extension of the mandible, extension of the maxilla. They are extensions of the mandible and the maxilla, not counted separately. The skull bone is the skull bones are subdivided into two main categories: neurocranial bones that holds and encompass the brain inside it, and the viscerocranial bones, which which compose the facial bones, mainly the facial bones. Regarding the neurocranial bones, it it is they are composed from flat bones are connected to each other by sutures, immovable sutures, and the first of them is the frontal bone, which is located anteriorly, forming the forehead. So when you touch your forehead, you are actually touching your frontal bone, and the other bones is uh, or are the parietal bones. Why I said the parietal bones? Because parietal bones paired, are paired. One is located on each side, and it is located in the superolateral part of your skull. Superolateral part of your skull. In the inferolateral part of your skull, the temporal bone is located. Okay, and posteriorly the occipital bone. Posteriorly the occipital bone. The temporal bone is also a paired bone, but occipital bone is a singular bone. Okay. Now the sphenoid bone, one of the most complex and important bones bone is the sphenoid bone. It is a single bone that connects all of the skull bones. I mean, all of the neurocranial bones to each other. It is like the master of the orchestra. He is the 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 cornerstone. The sphenoid bone is like the cornerstone of the skull that holds all of those bones together. So it has irregular shape. So it has a regular shape because it connects all of the bones together. And it has another important features. We will speak on them about them in the next few slides. And the ethmoid bone. I call the ethmoid bone the bone of the nasal cavity because it composes three parts of the three borders or three walls of the nasal cavity. It forms the medial wall, the lateral wall, and the roof of the nasal cavity. All of that is formed by the ethmoid bone. But it considered as part of the neurocranium because it has the cribriform plate. The cribriform plate forms part of the floor of the neurocranial cavity. Through the cribriform plate, the olfactory nerve pass to the olfactory bulb, then to the brain. So for that portion, it's considered as a neurocranial bone, and some anatomists consider the ethmoid bone as part of the neurovisceral part. I mean, viscerocranial part. Sorry. Now let's read some notes about the neurocranial bones. Frontal bone forms the forehead, as we said before, and what? And the upper part of the eye socket, as we said also. The eye socket, let's see here, the eye socket, this is the eye socket. The upper part of the eye socket is formed by the frontal bone. And parietal bones, which are paired bones that form the sides and roof of the cranial cavity. As we said, it forms the superolateral part of the cranial cavity. Occipital bone forms the back and base of the skull, including the foramen magnum. The foramen magnum, one of the most important structures located in the occipital bone, because through the foramen magnum, the spinal cord passes. You know, I think all of you know what is the spinal cord. Temporal bones, paired bones located at the sides of the skull, housing the structures of the ear, and contributes to the cranial base. Trimp, I sorry, contribute. Why contribute, not contributes? Because temporal bones are paired bone. They are not single, paired. Okay. Sphenoid bone, a complex bone located at the base of the skull, contributing to the floor of the cranial cavity and connecting with almost every other cranial bone, as we said before. This is the sphenoid connected to every other cranial bone. Here is connected anteriorly to the frontal bone, from the upper portion to the parietal bone, from the posterior portion to the temporal bone, from the inside to the ethmoid, and posteriorly to the occipital bone. So it is related to the oval bones of the neurocranium. The ethmoid bone, a light spongy bone. It is a spongy bone located between the eyes, forming part of the nasal cavity and the orbital wall. As we said, it forms the medial wall and the lateral wall and part of the roof of the nasal cavity. In addition, they form part of the orbital cavity, mainly the medial wall. The medial wall of it participates in the formation of the medial wall of the orbital cavity. Now, the facial bones. Facial bones. Regarding facial bones, we have the zygomatic bone. Let's start from the midline. First of all, we have nasal bones, are paired bones located in the upper part of the midline of the face. Then we have the maxilla. The maxilla are also paired bone, and located anteriorly. Then we have lacrimal bone, which which participate in the formation of the medial wall of the orbital cavity, and it is also a paired bone, and the zygomatic bone, which is also paired bone, which is the cheekbone. Your cheeks are formed by the zygomatic bone. Then we have the inferior nasal conchae. Inferior nasal conchae. The inferior nasal conchae is located in your nasal cavity, and you can see them through the nasal aperture. Okay. Then we have the vomer. The vomer. The vomer participate in the formation of the bony septum of the nasal cavity. The nasal cavity has two septum, bony septum and collagenous septum. So the bony septum is formed, part of the bony septum is formed by the vomer, and the other part formed by the ethmoid bone through perpendicular plate. The other bone is the mandible, which is the movable bone of the face of the skull bones. The movable bone is the mandible, and it aids in chewing, or it not aid in chewing. It function is chewing. Its function is chewing. Okay, and there is a bone that can't appear in this image. It is the hard palate. We will study about it in the next few slides. Viscerocranial bones. The viscerocranium, also known as the facial skeleton, consists of 14 or 15 bones. Because why? Why? Because if we consider the ethmoid bone part of the viscerocranium, we say 15 bone. If we don't, we say 14. It depends on the reference that you are studying on. That support the structures of the face. These bones provide the framework for the face, contain cavities for the sense organs, eye, nose, and mouth. Viscerocranial bones, as we said, they are the maxillae, paired bone, mandible, zygomatic bone, paired bone also, nasal bones are paired bone also, lacrimal bones, paired bones, palatine bones, paired bones, palatine bones that forms part of the heart palate because the other part of the heart palate is formed from the maxilla, and part the so part from the maxilla and part from palatine bone, inferior nasal concave bones, and the vomer. Another picture shows the bones of the visceral cranium, as we said before, is that the zygomatic bone, two zygomatic bones, two maxilla, two nasal bones, one vomer, two inferior nasal concave, and one mandible, and two palatine bones. Those are the cavities. This image shows you the cavities that is located that are located in the skull region. These this huge cavity is the cranial cavity that contains your brain. These two small cavities are the ears. These two laterally located and these two anteriorly located cavities and look like a triangular in shape. The orbits, and here two, and below them two nasal cavities with their paranasal sinuses, and below them the oral fissure and the oral cavity. Okay. Important notes. Most cranial bones are diploic. What is the meaning of diploic? Diploic mean it consists of the cranial bones. It consists of two compact bones at the outside and the inside, and between them, what? A spongy bone. So we call outer part of the bone the lamina externa, and the inner part of the bone lamina interna. Lamina interna. So this another picture shows you the outer table of the skull, inner table of the skull, and the diploe. Diploe is the spongy bone that contains the bone marrow and function in bone and blood formation, hematopoietic function. It has a hematopoietic function. But this is important um, info that you should know that the flat bones consist of outer table or lamina externa and lamina interna, and between them is the diploe is located. There are multiple sutures. Okay, the second, most facial bones are spongy. Most facial bones considered spongy bones. We know bones are spongy bones and cancellous bones. Spongy or cancellous bone and compact bone. So most of the facial bones considered spongy. There are multiple sutures that connect skull bones. There are multiple sutures that connect skull bones, as we said before. There are multiple foramina and key openings to provide passage way for multiple structures. The information that I want you to know right now that the skull contains foramina. We will study each foramen in the future, in the next few lectures. But now, all I want you to know that The skull contains foramina that connects the outer the outer region of the skull with the inner, the brain with the outside environment, with the outside structures. There are 8 or 9 paranasal sinuses. We will study them. And diploic. I'm, I'm explaining what the meaning of diploic here. Two compact bones with a spongy one in between that contains bone marrow. So we will study in the next few lectures the bones and the structures from each view. So this lecture was just an introduction to the skull. Uh, the details and the extensive details will be taken in the next few lectures. Thanks for now. Have a nice day and wish you all the best.